Okay, good afternoon, everyone. Thank you for joining our first session on ultrasound knobology. I'm Rene Atkinson, and I'll be taking you through some of the slides. We have with us Dr. Bernard, who will also give some input in some of the slides. Attending with us is also some of our team members. Most of you already met Yana. We have Ms. Riley and Carmen, who's joining from Mexico. All right, so
Thanks.
we go straight into ultrasomnobology. So guys, most of you, well, if not all of you, have an portable ultrasound at your health post. And this course or this lecture per se is to equip you with basic knowledge and the skills to help become better at diagnosing patients, revealing genders for pregnant mommies in your community, and to overall make you a better community health worker. All right, so let's go straight into it. So for our introduction, we will go through a few things like, for example, what is an ultrasound and why does knobology matters? Why are we doing knobology? Why is it important? And key point to note is that you as a community health workers, you are our hands and heart because we're not there, but you're there in the community. So you are the ones responsible. You're the one who will meet and stop your patients. You're the one who will provide care. And then we have the sonographer or the provider, which would be Dr. Bernard and another sonographer who will be the eyes and they will make a decision or a diagnosis, right? Uh, what is an ultrasound? An ultrasound, it's a safe, it's non-invasive, portable, and an affordable imaging technique. And that is what you have at your health post. It's a portable ultrasound. All right. The transducer is the portable ultrasound that you have that you can hold in your hands. Emits high frequency sound waves. It reflects off internal structures, for example, your organ, some blood vessels, muscles, and even tendons. The machine records how long it takes the sound wave to return to the transducer and uses this to generate an image. Now, I don't want you to get too caught up with this definition. Just the important thing for you to note is that it's a safe and it's a non-invasive procedure that you will learn to do. And it emits an image, and that is how the doctor or the sonographer can diagnose and note different organ structures in the body. We said earlier why knobology matters. Now, knobology, it's important because it's the knowledge of ultrasound machine control. And once used correctly or properly, it allows for the creation of a clear and accurate image. It's essential for diagnosis, and when it's done without correct knobology, the image or quality will not be the same, and this can result in misdiagnosis or inaccurate description of the structure that you're looking at. That is why knobology matters. This is the probe that you have at your health post. It's very easy to look and understand. And Dr. Bernard, can you just quickly go through the transducer phase and the orientation for me, please? Based on the image on the screen.
All right. So this is the probe. The side where the ultrasound or the hypersonic sound comes off is known as the active surface or the transducer face. Usually, there's a marker or a notch on the left-hand side, which is usually colored orange. You would want that to face you whenever you're doing the ultrasound. Just for normal practices, you usually want to be on the right hand side of the patient whenever you're doing an ultrasound examination. So you want to be on the right side of the patient and you want to ensure that the marker notch or the orange marker is facing towards you. You want to place your right hand on the probe and hold it like a pencil or a pen in that orientation. You'd want to hold it like that and place it on the area that you are examining.
Thank you
Yeah.
very much. Thank you very much, Dr. Bernard. Moving on. This is basically the same, almost the same what Dr. Bernard was explaining earlier, but I'll go into more in-depth images on how this orientation is being used. So when we talk about sagittal, this sagittal orientation, the marker should be pointing to the head. And this is an image portraying the sagittal orientation when attempting the ultrasound. Remember, your probe will be different is the one that we just saw on the screen, but this is just an example of how sagittal orientation should be placed. For transfers, it should be between right to left, and as Dr. Bernard explained, that it's easier for you to stand or sit on the right side of the patient. Now, we'll go through some basic knobologies and also orientation. We'll go through what is gain, what is depth, freeze, unfreeze, save, or store. All right, these are all features on your ultrasound that you have at your health post. Sorry, Dr. Bernard, can you go through this for me again?
Hey, sure. So the gain is basically the strength of the sound wave. So the ultrasound is basically what it is. It's what it says. It's basically a high frequency sound that goes through tissues and gives back an image on the probe. So the gain is basically the strength of that particular sound wave or the frequency in which it goes through the tissue. So the stronger the gain or the stronger the sound wave, you get a brighter image. Uh, Vice versa, if you have a smaller or a decreased gain, the weaker the image or the darker it will appear. So when something is radio opaque, it's usually darker, so you have decreased gain versus translucent or radiolucent, it's more darker or whiter you would see on the image. So basically the gain is the strength of the sound wave or the strength of the sound, and that would give you either a brighter image or a darker image depending on how much you have on the probe.
Thank you, Dr. Bernard. Uh, Interpreting the depth. You can go ahead, Dr. Bernard.
So usually the depth would be how far down the ultrasound waves do go down and the image that it does produce. So um more superficial structures would be closer to you or higher to the superior part of the probe or the top of the probe, while deeper or structures that are more visceral or you'd say deeper in the body would look farther away from the probe. So the probe is basically that concave surface is the probe at the top, and it's shooting those ultrasounds downwards. And the closer it is to the concave surface, concave, it's yeah, no, it's convex, sorry, that convex surface at the top. Um, that's the area that's closest to the probe, and the farther regions away from the probe is how far it goes down. So that's the depth.
Oh, great explanation, Dr. Bernard. Okay, so this part of the presentation will involve your ultrasound that you have, which is Echonos. Okay, so you know, on the tablet there is a charging port, and if you notice on the ultrasound, the cable has a Type C port which is connected to your charging port on the tablet. When you plug in your ultrasound, the app on the ultrasound is known as Cosmos. Okay, when you click on Cosmos, this will be the screen that will pop up on your tablet. It will go through some self-testing, license updates, and this is what it will say: Torso 1 test in progress. Do not disconnect. So this is just an overall how your screen would look like once you connect your ultrasound probe. This is the next screen that will pop up once all the test and license features have been passed. And you will see these are the different types of ultrasounds you can do with your probe. So you can do a heart ultrasound, a lung ultrasound, abdomen, obstetrics, and gynae ultrasound. This will depend on your patient, what they present with, and Dr. Bernard will guide you through the different ultrasound, whichever he wants or the ultrasonographer would require once the patient visits your health post. Now, once your ultrasound has started, these are the different options that will show up on your screen, and we'll go through a little bit more in depth. So if you notice at the top where you see abdomen, and there's a little white arrow pointing down, this is the exam preset or the preset menu. We'll go a little bit into depth into that in a few minutes. Then the second, you will see depth and gain. Gain and depth is what Dr. Bernard would have explained earlier in the presentation. And then we have something called TGC, which is time gain compensation. And we have the gain, which can increase the brightness or darkness. You'll notice a symbol that says 2D, which basically means the imaging mode can be a 2D or Doppler. So the Doppler option is at the bottom here. It looks like a little waves, like two triangle, a little wave. That is the Doppler feature. And then freeze, to freeze an image, you will use this this is like a snowflake. And for color on Doppler, you can also use it will show different colors, and the doctor will be able to diagnose based on the colors. All right. Then we have at the bottom here, you can capture an image with the first option. You can also, the first option would be images that you would have already captured using the camera option in the middle. And you can also do a scene loop or scene loop, which is basically a recording of the screen or the image that you're seeing. All right. So these are just some options you can play around with. Or if Dr. Bernard say, hey, Verlina, can you increase the gain? You know where you have to touch, and you will see the option to increase or decrease the gain. Or you can say, let's go to 2D model. You click on the 2D, sorry. Or if you want an image to freeze, you click on the snowflake, and the image will freeze. Now, when you click on the preset menu, these are the different options again. So you can select heart. It will switch over to the heart mode. Lung, it will switch over to the lung mode. Abdomen, so these are all the different options you can change while you're on the call. And if you notice at the top right-hand corner, just over Cosmos, there is this little icon that looks like a little telephone. When you click on that, it will give you these options. So you can either go back to the call, you can increase your volume, video on or off. All right, so this feature is also important, especially if you need to go back and restart the ultrasound or to restart the share screen on the ultrasound on your tablet. We'll go through more on the workflow in coming on to the end of the presentation. What is also important is the different maneuvers that you'll need to learn once you are doing an ultrasound. So many of you would have seen an ultrasound done. The ultrasonographer would usually place the probe on the patient. Say, for example, the patient has done an abdominal ultrasound. The ultrasonographer will place the probe on the patient's abdomen. Now, the ultrasonographer will not just place it on the abdomen and leave it like that and interpret the image. They have to do some movements, or what we will know or come to know are called maneuvers, right? So we'll go into a little bit in depth for the different maneuvers. There's actually 6 maneuvers, and they are, the first one would be slide, rock, the second one, sweep, the third, fan, the fourth, pressure compression is the fifth, and finally we have rotation. So when we talk about slide, this is a slide example. All right, so picture you placing an ultrasound on the surface or on the abdomen. For example, this ultrasound is being done on the chest. Sliding is basically moving it across in an up or down motion without lifting the probe from the patient's abdomen or the area that you're doing an ultrasound. So just picture you sliding across the floor without getting up. That is exactly how you slide. So maybe Dr. Bernard, can you slide the ultrasound to the patient's above the patient's breast or under the patient's slide? That is what it's meant when we say slide. Rock is basically picture something rocking like a rocking chair. Remember when a rocking chair rocks, it doesn't leave the full, it stays on the surface. It doesn't come up entirely. So you basically rock it from side to side. And when doctor gets the perfect image, he will let you know when to stop rocking. Right, moving on to the third, which is sweep. It's the motion in the short axis of the probe across the body with a consistent angle of inclination at 90° to the target. So this is basically moving it in a circular motion. Correct me if I'm wrong, Dr. Bernard. That's how I understand it.
That's correct.
Okay, great, thanks. Move it in a circular motion. Well, they got different sweeping techniques that they use, but just picture yourself sweeping and just rubbing it in a circular motion without lifting it off the surface or the organ. Fanning, it's the motion in the short axis of the probe along a fixed point of the body while changing the angle of inclination away from 90°. Almost similar to sweeping. It's just that you're not doing it as farther as sweeping. You just do it like in a, how can I explain? In a little bit, in a shorter form. The fifth is pressure or compression. All right, this is basically pressing down on the abdomen. So when doing an ultrasound, you don't need to be very lightly. In some cases, doctor will have to ask you to apply pressure or compression. And this is see the in-depth images that we explained for depth earlier. And this will show us an image that is in the, like way at the bottom. All right, so that was applying some amount of pressure on the patient's abdomen. It can be uncomfortable and it can cause some amount of pain, mostly discomfort. So when you will have to do the compression and pressure, you need to explain to the patient that I'll have to press down a little hard on the belly and it may be a little bit uncomfortable. And finally, rotation is just moving around the compression axis in a clockwise or counterclockwise direction. So like the sweep, but you're doing it in a wider circumference. So you're going in circles, but you're going in a wider circumference. This one is here twice, sorry. So the difference between sweeping versus fanning. Sweeping is moving the location of the probe on the patient's body, and fanning is keeping the probe where it is, but changing the angle side to side. Right, now let's move on to image optimization tips. So sometimes you may apply your ultrasound probe and you just see a dark screen. You don't see any images. Then you need to ask yourself, did we apply enough gel? So you will have an ultrasound gel, but you can also use the lubrication jelly that is provided at most of the health posts, if not all. And the reason why we apply gel is because in ultrasound, the sound waves travel better through liquid than air. So it creates a better image quality. So if you just apply the probe without any gel, you will not see an image. You'll just see a dark or a gray screen. And you'll need to apply gel in order to complete the ultrasound. If you don't see a proper image, even with the gel, you'll need to confirm whether it's on the patient's skin, because you're not going to do an ultrasound with a patient and they have on a shirt, right? So the patient will need to be, you need to make sure that there's skin contact. So the patient should remove the shirt or the jacket, whatever they come into the health post, and you apply it to the skin. Other methods or tips, you can adjust the gain and adjust the depth, which is on the screen, and definitely patient position. So for a patient that you need to do an antenatal a mother patient will need to be in the lying position, right? They can't expect the patient to stand up and do an ultrasound on the patient. So position is also important. Common errors or and fixes. If the image is upside down, you need to make sure that the marker orientation is facing you and the other is facing the patient. If the image is too dark, you can always increase the gain. And if, for example, Dr. Bernard or another sonographer sees one of the images are organized, not seeing it in depth, you can just adjust the depth or slide the probe, all right? Or do the different maneuvers to get a quality image. Your role as a CHW when we do tele ultrasound is to ensure that you maintain clear communication, close loop communication with the physician, for example, Dr. Bernard, follow his cues or his instructions, ensure that you move slowly and conform before adjusting any position. Close loop communication is, for example, if Dr. Bernard says to you, can you please increase the gain? You're not going to just increase the gain and don't say anything. So, okay, Dr. Bernard, gain has increased. It was 50, but now it's at 75%. All right. So if Dr. Bernard said, move the probe right, you move the probe right and not move the probe left. So that is following the instructions. You're not going to move very quickly with haste. Remember, it's a very delicate procedure, and many of you might as well start doing it for the first time or the second time, and it takes a lot of practice. All right. So just confirm before adjusting any settings on the ultrasound with the doctor. So a quick overview of your workflow will include definitely prepare the patient, inform the patient about the procedure, tell them what to expect. For example, the gel, in case if your health post has air conditioning, it might be very cold. It might make the patient feel a jump when you place a cold gel on the skin and they're coming in warm. Explain to the patient that it will require some amount of discomfort, as well as they'll need to remove certain clothing. So your job is to provide privacy and maintain confidentiality with the patient, right? Make sure you place the probe or the orient marker correctly. Adjust your depth and gain according to physician's instructions. Take images. Sometimes you may, for some antenatal mothers, you might end up seeing a fetus. Take an image of the fetus and it will save into the patient's profile. All right, and always follow the guidance from your sonographer or provider once you're on a telemedicine call. And like Dr. Bernard was mentioning earlier about positioning your patient, you want to place the patient in the supine position. You can provide a pillow. And if you notice this nurse, she has a blanket at the patient, and you see the way she's holding the probe, and she's standing on the right side of the patient, and she has a towel to the head of the patient. So this will give you an ideal view of the screen, as well as an ideal, if you're predominantly a right-handed person, it will be easier for you to hold the probe, and you can always capture an image using the left hand on the screen. All right, so this is the ideal position for mothers who will have to do any ultrasound. And please note the way she's holding the ultrasound. The probe, sorry. All right, so key takeaways for this presentation, we know that knobology is just in layman terms, is the machine language. It's how you interact with the ultrasound, the interface on your screen. The probe orientation is critical because if you don't place the probe correctly, you can cause a misdiagnosis. So it's really important that you learn the different orientations, learn the different maneuvers. Communication is everything when it comes to doing an ultrasound because remember, you are the ones doing the ultrasound way in Region 7 and Dr. Bernard is at the Ministry of Health, right? So it's critical that you communicate clearly, concisely with your provider. So at the end of the ultrasound, you have a correct diagnosis for the patient. And the benefits of the ultrasound was totally dependent on your skills. So in order to enhance your skill, you'll need to practice. You can even practice on your colleague. You know, if you have the time during the day, hey, Rene, I want to practice the ultrasound. Can we jump on a call? And if Dr. Bernard has the time, we can jump on a call, do some practice sessions. All right? Any questions?
Good afternoon, Rene.
Good afternoon, Rexon.
My question about the the updated or what you call it again about the ultrasound because recently the cosmos thing was like only the abdomen, heart, and lungs. I think.
Okay,
And
we go
when
ahead.
I click on that at the abdomen, like in the normal ultrasound, the thing that's come out like it'll show how many weeks the gestational age,
Mm-hmm.
but in that ultrasound we didn't see anything like that.
Okay, I think we need to update your ultrasound app on your tablet. We can do it after the call or maybe later in the day.
I'm sorry, Rene, I'm at home. I'm not at work.
Oh, that's fine. Maybe next week we can do that. All right. So now,
Maybe by tomorrow I'll do it.
okay, let me know. All right. So the last thing
Okay.
I want to go through with you is the workflow from beginning. We came with a video, a short video which I'll play. And before I play it, it's the same workflow that you do every day. Logging in the tablet, create a patient profile or search for patient profile if they're already created. Please do the patient vital signs and then go through the rural telemed clinic, go through all the different steps by filling the patient's information such as allergies, any medication they're on, health history, the complaint, if it's for antenatal visit, plus ultrasound, then you place your call. When you place the call and doctor pick up the call, then you click on the menu on the screen and you will see the different options. You'll go to Cosmos, click on share entire screen. But this is all being the video, but I just wanted to verbalize it so you guys will remember. All right, so this is the video. So if you notice, the person that is logged in is a CHW named Alicia, just for example, and she loaded a patient, which is Lily Murray. So you'll notice that the patient's name will be here, and the person who logged in will be at the top left hand. All right. So you go through the different workflow, put in all the patient different information. Remember, weight is compulsory. This is the health history. You click start visit, it will take you straight to the call. So this is when the doctor picks up. This is the clicking on menu at the top left-hand corner. Scroll all the way down to Cosmos, which is the ultrasound app. Click on the app. When you see this menu, you click on the drop-down menu and click on entire screen and click start. By then, you should already have your ultrasound probe connected to your tablet. Once you see the green margin across the screen, it means that you start the screen share. See, she took an image of the screen of the shot, and she took two images. So you notice at the bottom that it says that it has two images already there in the patient profile. And this is basically recording a shot of the image as well. So there are three files now. We have two images and a short video. This is the first image, the second image, and this is the first image that was taken. When you finish it, click on complete exam. Click OK. This is just to show you. You see why it's important to load a patient profile or create a patient profile, because when you do all of these things, you're able to capture it into the patient's database. So if the same patient goes to a different telemed site and the health worker or the doctor there search for this patient, they can actually go into the patient profile, see the different images, see the report that Dr. Bernard would have made on the patient profile to give them some context about the patient current situation or medical condition. Then the famous wrap-up form. Before you turn off the tablet or leave it there to admire it, you'll want to click on this part at the top here that says End Encounter. And this is what we call a wrap-up form, will pop up on the screen. You're required to fill the information on it and then click on Submit. All right, so that brings me to the end of this presentation. Let me stop the recording.